Thank you, Daniel, for those inspiring opening remarks. We're delighted to be here. I think as a member of the Board of Stewards of Change, I'm very proud of the work that's gone on in the past 11 years now, and the instances in which we've been able as a group to create stewards of change throughout the country that are influencing this progress that Daniel talked about. But as Robert Frost put it so well, we have miles to go before we sleep, and we have miles to go before we sleep. And he repeated that phrase to make the point that we're not anywhere near done. I agree with Daniel that this is a journey, not a destination, and we'll never find that point where we can stand on the end of infinity and say it's done. We don't expect to reach that, but there are two themes that Daniel sort of introduced to you that I want to reemphasize as the purpose of why we're here these 2 days. And the first theme is to recognize and explore the utility of this notion of social determinants of health. This whole concept is, I think, electrifying the health and human services world, and hasn't for the last decade. So much so that major institutions like the Robert Wood Johnson Foundation and the National Academies of Science, Engineering, and Medicine have stepped up to suggest that it's time we collected the data about the social determinants of health, and that we used that data not only to help clinicians treat patients, but to help public health agencies formulate strategies to deal with these issues of the inequalities in the availability of health care and the problems of the social determinants. And the studies have shown conclusively in many, many instances that the social determinants of health are more powerful indicators of community wellness than is the availability of health care, which is contrary to the thinking of the last several decades, where we sort of implored the lack of availability of health care around the nation and the world. And we've found now that those social determinants are much more important. So that whole electrifying notion has led us to consider, how do we attack these issues that come before us for dealing with the influence of things like poverty and educational level and the other social determinants. And I suggest to you that it's time we actually do what was suggested a year or two ago at this meeting, of renaming the department to the Department of Human Services and Health, and making clear that what we're talking about is community wellness, not about just individual outputs or measures. So we're really embarking on, and have been, on what I think is a major intervention, and that is our theory of change is that it's important that we share information across and among those communities of interest who understand the need for collaboration and will have an impact on community wellness. Even law enforcement is now talking about community wellness as the objective of law enforcement. Commissioner Chuck Ramsey, formerly a commissioner in Philadelphia, introduced that notion and said it's not about, the police function is not about responding to crimes, it's about community wellness, and it requires us to think about how do we contribute to that measure, not just about how do we respond to calls for service. So that's one of the themes of why we're here to get together, is to consider those truths that we've discovered and figure out how do we do that. And some of our speakers this morning have been taking a look at these issues from the perspective of their federal agencies, and we'll be talking more about that. The other theme that Daniel mentioned that's important, and I want to just elaborate just a bit on what he said, is this notion of as he put it, the network of networks. I'm not sure that's really the right word, because what we're really talking about is the importance of collaboration. And it's much broader concept to me than sometimes when you talk about networks, those technologists among the crowd, and I kind of am one of those, think about the physical connectivity of systems, and we're really, even though Daniel talked about the human side of that, we're really trying to figure out how we can eliminate the problem of boundaries of domains and enterprises constricting the availability of information from those who need it. And it's, when we started thinking about this as a nation several years ago, a lot of people were talking about this very bad thing of stovepipes, that all these systems that we build are stovepipe systems. And I think we've matured now and understand that that's the way life is. We build stovepipes. Our society and our government actions are built on stovepipes or silos or legacy systems, whatever you want to call them, and it's not useful or productive to think about replacing them all. The question is more, how can we ensure that the information that is contained in any given silo or stovepipe is available to those who need it, who are working in another completely separate enterprise? And how do we connect those silos and stovepipes in a rational way to really make it easy for that information to be available? So we're not going to change Congress. Congress is the most stovepiped of all, and the way committees are organized and the way they fund things, and that's just a reality. So those of us who want to think about how do we deal with this, how do we bring this all together, we have to focus on how do we build the bridges amongst those stovepipes or silos or whatever you want to call them. So we have some very good speakers for you this morning who come from federal agencies who are thinking these strategic thoughts and implementing programs to try to deal with it. I have to say at the outset that most of you have been around long enough to know that this time of a transition in administrations is a difficult time. It's about this time towards the end of administration where people run agency programs sometimes say, well, I don't want to do anything new now because the next guy coming in here is going to take me in a different direction, and I better not start anything that he or she might not like. And so things kind of tend to slow down. It's also true that a lot of people in the federal government around this time, this period of time between now and the election, start job hunting and start leaving, and some people leave sooner than others. Well, I want to assure you that's not true with any of our panelists today. These folks are committed, serious contributors to dealing with the issues that I just talked about, and they're here to really focus on what their agencies are doing about it, what they'd like to do for the rest of this administration, and what they think might be appropriate for the next administration to consider. Because a lot of us are going to be involved, many of you included, in providing advice to the next administration and all of the people that end up working for it, including maybe some of you, who will start to look at what is next for us as we deal with these issues of the social determinants of health and how we build collaboration. So with that, I'm not going to read the whole bios of our panelists. They're in your folder. You can read them. I don't want to take any more time to do that. I will introduce them briefly. As Daniel mentioned, Jessica Kahn is off being a coach for a baby birthing, and we wish her well in that process. But we have with us Kshemendra Paul, who's the program manager for the information sharing environment, which is Kshemendra was appointed by the president to tackle this major problem of how to build a national information sharing environment that overlaps all elements of government and focused initially on counterterrorism, but the processes and procedures that you'll hear about are much broader than that. And Kshemendra was the chief enterprise architect at the Department of Justice before he became the federal enterprise architect at OMB, and the president then recruited him for this job. Dr. Melinda Baldwin is the senior policy advisor for health and well-being in the Children's Bureau in HHS, and we're delighted that she could join us, and her focus is also on the future directions and strategy for us. And then my friend Christopher Traver from the Administration of Children and Families. Chris was on the program last year, but he was then working for the Justice Department and couldn't make it. He got called away for an emergency meeting before he could come and speak to you all, and I was stuck with impersonating him. And he saw the video of my attempts to impersonate him and demanded that he come back this year to counter what I said and see if he could correct the misinterpretations. And in the meanwhile, he went to work for the Administration of Children and Families and has now the responsibility for information sharing across not just the Administration of Children and Families, but throughout HHS to help introduce some more advanced notions, and we're just delighted to have him and Melinda and Kshemendra with us today. I've asked each of them to give you a short statement about what they're up to, basically, about some of these issues we've been talking about, what their organizations are attempting to accomplish in the short run, and then talk a little bit about where they see this going in the future. And then we're going to have a dialogue here. We're going to take time for questions, and if we run a little over, it's because we started a little late, Daniel. So I want to give you a chance to question these people, because you have now really serious representatives of the federal government who should be held accountable by you all for their work and their contributions to this field. So with that, let's start with Kshemendra. And I think we have a way to turn some slides on and off, if you like. That little button should work there. Kshemendra Paul.
Good morning. Good morning. So I've spoken here before at this conference in the past. Really enjoy coming up to the Bloomberg School, to Johns Hopkins. There's probably some folks that are new in the room, so I want to give just a little bit of background about me and my office, and why is there somebody here from the Office of the Director of National Intelligence at a Health and Human Services conference, public health conference, and then hopefully give you some answers to that question. First off, the purpose of my office is really to drive a network-centric approach to counterterrorism, homeland security, weapons of mass destruction related information sharing. Now, as was talked about by Daniel with his remarks about interoperability, did I say that right? Yeah. And the network of networks, this is not about technical networks, it's about networks of people, organizations, capabilities. In the Department of Defense, they call it a net-centric approach, network of networks. Some of the other parlance used is communities of interest and federating across a community of interest, and then interfederating. And so over the years, we've actually had some success with it, and some of the ideas, lessons learned, some of the resources that we've been able to distill, we believe are applicable more broadly. I also want to thank Daniel and Stewards of Change for inviting me back. Paul, thank you for the work you do, and thanks again, Daniel, for acknowledging the horrific events yesterday in Orlando. Appreciate that. So, the 9/11 Commission talked for a whole-of-government approach to sharing information, information being the lifeblood of enhanced collaboration, make proactive decisions through that collaboration and information sharing to prevent harm, increase resilience, improve response around terrorism-related information sharing. We span the entire federal government, working with our state, local, tribal, private sector partners across 5 different communities. The point is to empower frontline operators, investigators, and analysts. And we build on the information technology industry, because this net-centric approach is all about scaling through standards, architecture, common processes, common policies, and the like. There are several big ideas here. Number one, distributed, decentralized, yet coordinated. Very much a net-centric approach, the internet being the ultimate example of a net-centric approach. Dual use. The vast majority of our mission partners have relatively sparse terrorism-related information sharing holdings. At one end of the spectrum, of course, you have the FBI. You've got pure play entities like the National Counterterrorism Center. But when you're talking state and local law enforcement, whether it's in Orlando, San Bernardino, Chattanooga, other federal agencies, terrorism is an important mission. Homeland Security is an important mission. It's not the primary mission. So it's important that the capabilities that are used for the terrorism-related mission work across the entire enterprise architecture of participating agencies, communities of interest, and what you have there. And then finally, distilling out the frameworks, right, so that we can get industry buy-in, so that agencies can procure and deploy these approaches, so that the capabilities they do deploy are interoperable with their peers, with other potential partners. So it's a huge challenge. The way I like to describe this is post-9/11 and that national trauma, we moved from an intractable problem in this domestic nexus of national security and public safety to just an awesomely complex problem. And that's momentum, that's progress, right? The journey that Daniel talked about earlier, stay with it. It is a thing where this kind of activity is a worthy and noble endeavor, but it does take time. At scale, though, we've made progress. 78 fusion centers across the country. They're relatively mature. This is the year when they're being assessed as having achieved maturity across the network. Aligning field-based intelligence and information sharing entities. Back in the 70s, this country deployed RISC centers, regional information sharing centers, on the war on regional organized crime across the country. HIDA centers, high-intensity drug trafficking area centers, in the war on drugs in the 80s and 90s. Fusion centers and organic response by our state and local partners post-9/11. Joint terrorism task forces. Many of you may have heard the brief from the ongoing coverage of what's going on in Orlando, and the FBI is the lead in terms of terrorism-related investigations in this country. All of those entities now work together. I won't say seamlessly in every aspect across the country, but it's a big deal for me to be able to say that they work together and not competitively or not in silos, that they're sharing information, sensitive and classified information, that they're collaborating effectively both on proactive prevention, strategic intelligence, and investigation and response. We've been able to touch frontline law enforcement across this country through operational information sharing and the like. And a great example of dual use, and something that's immediately apropos for this community, is an initiative we started many years ago with our friends with the Global Justice Information Sharing Initiative, the Department of Justice, National Governors Association, National Association of State CIOs, many law enforcement associations, is the idea of statewide information sharing environments, regional information sharing environments as building blocks for a national ISE, driven by local use cases, but using consistent national approaches so that they are interoperable. Some great examples here related to some of the topics you're talking about. New Jersey is a flagship for us. We've been working with New Jersey for many years. New Jersey has been able to use, in a dual-use kind of mode, the terrorism-related investments they've made and the information sharing investments they've made against the heroin problem. They are the gold standard in terms of intelligence and law enforcement information sharing around the heroin epidemic in the country. And it's gotten to a place where they're bridging between the law enforcement community and the public health community. So now you have intelligence-led public health, right, where they're able to target interventions in communities, schools, through real-time information on individuals involved in heroin, fentanyl, opioid abuse, and the rest. Saving lives every day, and it's something that we're trying to scale up. What's wonderful about this, in this tragic epidemic we're seeing, is that it's without new money. Right? How many times can you say that in the federal government or in state and local government, that you can take on a new mission across boundaries, as significant as that, without incremental cash, without a new law? Right? It's dual-use capability. Some other examples of where we're doing this is in Illinois. There's a focus, again, I think of interest to many of you, on continuity of care for inmate populations that are leaving the jails and prisons and coming back into communities. Alabama had a really interesting example where they were focused on populations that had mental health issues, leaving the jails, coming back to communities, and wanting to make sure that the reentry was successful. So how did they share information from a law enforcement context into a health and human services context? You know, how many folks have ever taken on trying to bridge the SIGIS security policy with HIPAA, right? How many folks' heads are popping off right now thinking about how to do that? Well, the frameworks for how you actually break that down and look for like-to-like and differences, that's part of what we've been able to distill out of the work we've been doing. 3 examples, 15 states participated in the summit. We got another summit coming up. We're working through national professional associations. That's how we operate at scale, is through the national associations. You know, that's the only way forward, and with the, you know, the extreme diversity of folks across this country in our constitutional system and federated democracy. So I talked about the distilling of the frameworks. We use the Standards Coordinating Council. I have what's called a FACA exemption, Federal Advisory Committee Act exemption, so we've stood up a public-private partnership with that, with international standards organizations, with industry associations. Steve Ambrosini is here. He is the Executive Director of the ISES Institute. He's a leader within the SEC, so he's going to be on a panel later on, and please talk to him about that, or talk to me. It's an incredibly effective body to make sure that the frameworks that we've developed, we have a pathway to distill them in a mostly mission-agnostic way, right? It's mostly mission-agnostic in the same way we're all trying to work towards a more perfect union, right? These standards and frameworks do come out of the law enforcement counterterrorism space, so it'd be facetious for me to say they were totally mission-agnostic, but they are, relatively speaking, they travel well. They do carry across other domains. 2 key pieces to that. One is the ISE Core Interoperability Framework. I'll talk about more about that in a second. And then Project Interoperability, which is the operational wrapper around that. The heart of Project Interoperability is the playbook. It's a what do I do next, looking at it from a system development lifecycle kind of perspective. And in particular, anybody here familiar with the U.S. Digital Services Playbook? So a few folks, and agile approaches are highlighted there. We took that playbook and extended it with security and privacy controls, the idea of communities of interest, maturity models across those communities of interest, and most importantly, leveraging existing resources, whether that's frameworks, standards, or shared services. Right, so it's gotten a lot of play, and it was developed primarily for that state and regional ISE initiative I talked about earlier. So our vision for interoperability, right? We sit at the center of this. Because it's my slide, I get to be at the center of it. You know, the idea of you know, how do we bridge different agencies and communities? It's through these interoperability frameworks and standards. How does somebody on-ramp, right? It goes up into the upper corner. Somebody's got to share information with somebody else, one agency with another, right? Our goal is to make it faster, easier, lower risk, better outcome to do it using these frameworks. Using the frameworks, then you buy the optionality of plugging in into the statewide ISE, into a regional ISE, into the federal counterterrorism ISE. You know, you may come at it from a mission interest ISE. A great example, the most mature one we have is the maritime domain, which goes across federal, state, local, military, Coast Guard, and so forth. You know, you can imagine a heroin anti-opioid ISE. You can imagine a continuity of care ISE, a mental health reentry ISE. All of those can exist at arm's length from the federal counterterrorism ISE and leverage what we've done because of our efforts to align with international standards and industry associations and the like. So I talked about Project Interoperability as the operational wrapper around. It's things like the executive guide, the playbook, exemplar solutions, training, governance, all of those sort of things that you need to take the core technical interoperability frameworks and actually make them useful and usable for folks within our core terrorism-related space, with agencies that want to participate but have missions elsewhere, for other folks. This work is ongoing. It's, you know, different pieces of it are different levels of maturity. Some, like NEAM, have been around for a decade, the National Information Exchange Model. Other pieces, like this core to federate and standardize and automate policy enforcement across communities of interest, is relatively new. The assertion-based architecture is worth drilling on. That's the way we bridge, for example, between the HIPAA, which is governing in the health and human services space, and the SIGIS, which is more in the law enforcement space. SIGIS is Criminal Justice Information Services as a part of FBI. is by breaking down these very big monolithic policies and mapping them to the NIST frameworks for the atomic controls for privacy and security. On the security side, we are looking at the NIST 800 series, the PIV-I, and also the Federal Identity, Credential, and Access Management Roadmap, the state equivalent published by the National Association of State CIOs. On the privacy side, we're looking at about 15 different frameworks, every one we could find, from the Fair Information Privacy Practices to several European frameworks. These atomic controls then allow you to look at apples to apples. The example I talked about earlier that Alabama did a pilot, I want to say 3 years ago, they found a high degree of overlap when they took that atomic controls for how people, onboard, establish credentials, establish mission use, establish training around privacy protections and the like, enough so that they could actually do the pilot and have a roadmap, if the pilot was successful, to making policy changes downstream. So we think that core interoperability framework and its work towards federating policy is key to bridging culture, bridging stovepipes, creating a network-centric approach. I talked about the Standards Coordinating Council. Again, it's an open kind of forum. It's how we are able to tie together both the demand side with agencies, federal, state, and local, as well with with industry and standards partners to make sure we have that alignment. And with that, I'll hand it over to my colleagues, fellow panelists. Thank you.
Thank you, Kshemendra. Melinda, would you join us?
So thank you, Paul and Daniel, and thank you for inviting the Administration of Children, Youth, and Families to this very distinguished event. And I'm honored to represent Commissioner Lopez here. As some of you know, ACYF is composed of 2 bureaus, the Family Youth Services Bureau, which works with problems such as adolescent pregnancy prevention, the Family Youth Violence Prevention and Services Program, and the Runaway and Homeless Youth Program. I came from the Children's Bureau before serving with the Commissioner, and we're the federal agency that works with children, youth, and families to ensure the safety, protection, and well-being of those children who are at risk of coming into the child welfare system or are already there. And so in order to do that, we monitor 4E agencies, we fund discretionary grant initiatives, and partner with other federal agencies to provide technical assistance and research in the areas of child maltreatment. So we're just on the heels of 2 very exciting events. As Daniel mentioned, our hackathon, which was just a couple weeks ago at the White House, excuse me. And so at that event, we brought a mix of technology leaders, child welfare experts, and concerned citizens to really think through some of the issues that child welfare has around technology. And what was so unusual about this event, and I see that Sixto has temporarily left for a minute, was that it was led and planned and really discussions were focused on youth that had been in foster care. And so that's one of the themes I'd like to leave you with today, is really thinking about the participants in the service as you begin to construct networks and think about data systems. The other thing we can't forget is, thank you. Is our comprehensive child welfare information systems regulations were released 2 weeks ago. And this event is historic because it was the first regulation in 23 years around data systems and child welfare. That regulation for SACWIS was published in 1993, and you can just imagine just look at your cell phones. We know what has changed in 23 years, so we're very excited about this. And CWIS will focus on data, not so much about business functions, but where that data is collected and really encouraging data sharing. So as you head into 2 full days of stimulating presentations and dialogue, I want to leave you with some ideas to think about as you take on one of the three of the biggest challenges that we face daily in child welfare. I'm of the mind that often asking the right questions is one of the biggest steps towards addressing those challenges. And so I encourage you to ask each other a lot of questions, knowing that the answers may not be immediately forthcoming, but that hopefully that dialogue will lead you on that path. So ask questions of the people in child welfare leadership, of the end users, especially of the end users, not only of the casework staff, but also of the children and families that child welfare works with. So we know that children in the child welfare system have multiple risk factors and poor outcomes, including their trauma histories, neglect, poor and chaotic parenting, medical issues, and at times they go through multiple placements. And so in addition to those well-documented factors that happen during that child's lifetime, we also know that prenatal exposures to substances may also affect that child, bringing them into their lives, 2 or 3 steps behind, trying to deal with the challenges that they face. And so in our communities and our families, think about the child welfare occurs at multiple layers of intersection, right? It's parenting and domestic violence. It's parenting and mental illness, parenting and the stresses of poverty, under and unemployment, parenting and substance abuse, just to name a few. So child welfare work is found in those places that are in between. That caseworkers help parents find treatment in their communities, find recovery, but it's in those places between child welfare and other systems in the community. And so that's why the concept of interoperability is so critical to child welfare, because of those places in between. So how do we capture that information and make it useful? How can that data help practice? And how can we ensure that sharing that data is helping children and families? And so we don't want to just build a system that shares information, right? But we want to have it share information that moves the practice forward. We want to obtain additional complete and reliable and consistent data about the children in our system. We want to identify what we know, but also what we need to know. We want to build that coordinated, collaborative approach to be able to make data-driven decisions about what's best for our kids and families. And most importantly, we want to be able to evaluate our outcomes of not only the interventions that we're doing, but also of the data sharing itself. So what do we know? We know the impact of opioids on children and families in the child welfare system must be placed in the concept of the history of parental substance use disorders. Families and child welfare agencies have been affected by multiple drug epidemics over the past several decades. We had crack cocaine in the late 80s, methamphetamines in the early 2000s, and now we have opioids. So we hear from states that they are seeing increases in the number of children and families that have been affected by opioid usage. This mirrors what we see in the media. This mirrors what you're seeing as well. But this is where, when we try and really unpack how this is affecting in a data use way, that's when it gets a little bit tricky, right? Because the information isn't all in one place. So from the federal side, we know we have legislative requirements. We know that we monitor states in their use through 2 different places. We have the CAPTA state requirements, which means that on a yearly basis, state submits plans of safe care. So how are they going to monitor and care for children who were born exposed to neonatively to substances? And we also provide limited funding for them to implement community programs to help those families. The second is through their annual progress and services reports. And so that helps update us in what's happening in their states. With all of the media attention, we've asked for states to give us additional reports on how they're going to address this in their state. So we're really looking forward to June, at the end of this month, to getting those new reports. We also provide money for technical assistance. Our National Center on Substance Abuse and Child Welfare gives targeted technical assistance. And so we get information from their work. We also give regional partnership grants, which are discretionary grants, and so we have lots of information about the good work that they're doing, that we're building evidence-based interventions, and so we're beginning to get a sense of what works. So we still don't have a full picture of how the opioid crisis is affecting child welfare. So we have two national databases, which I'm sure you're familiar with. Our AFGARS, our Adoption Foster Care Analysis Reporting System, gives us information about children who are removed from their homes. The National Child Abuse and Neglect Data Systems is a voluntary data collection system that gathers information about the front end, about reports that are given to child welfare and how, you know, how those reports lost my train of thought. And the voluntary data collection system that gathers that information about reports of child abuse and neglect. But what do those tell us, right? We know how many, the percentage of victims from 2012 to 2014, where the risk designation factor of parental drug abuse has increased 5.7%. But we don't think that's the whole picture, knowing what we hear in the media. The number of children being removed and placed in foster care has risen 5.1%. During the same time period, the numbers of children with at least one parent who has a drug use problem has gone from 28.3% to 32.2%. That's of the kids entering foster care. So we're getting a sense that the problem is growing, but really not understanding how it is impacting on a day-to-day basis and how the communities are working through that. What we also know in terms of collaboration is that what works in communities are being able to identify families, making sure they have timely access to programs and services, that they have recovery support networks, that there's comprehensive family services, not just substance abuse treatment programs, that there's increased judicial oversight, a cross-systems response, and collaborative structures that happen on a regular basis. All of that is needed to help families recover and to parent their children successfully. But as of yet, we don't have that system that brings all those pieces together to help us really look at different communities to see where we need to intervene. Two other things I'd like you to keep in mind as you think about building these systems and identifying information that will be useful is the data is political, right? That the values we have and the priorities we set drive the kinds of data we collect, how we use that data, and then how we factor them into our decision making. And so I'd like to quote the Commissioner of New York City's Child Welfare System back when we had the hackathon, and DG Patel, the chief data scientist for the White House Office of Science and Technology Policy, asked her what she thought about using data for predictive analytics in her agency. And what she said, I think, is something that is important to keep in mind. I think about how we are impacting and infringing on people's civil liberties, she said. She runs a system that exclusively serves Black and brown children and families. I am concerned about widening the net under the guise that we are going to help them. How can we use these tools to keep children and families and communities together safely? So I ask you to think about clarifying our values and mission to better understand how we collect data, that we need to ground our data collection system, our system integration decisions in those values and in our missions, and ensuring that a greater focus on prevention is what we focus on throughout the field. So think about the practice of child welfare. What do we need to know? How many infants are born drug exposed? Where do they live? How many of those infants are returning to unsafe homes? What resources are in those communities in order to help them? Do mothers having substance-exposed infants have access to those services, right? Not only that we have them, but we have access. And then what kinds of data will help us get there? And can we make sense and use of the data we already have? And then the final thing is to build in that evaluation piece, the robust evaluation system. So not only outputs, is the system integration working? Are the systems receiving the data? Are the appropriate safeguards in place in protecting children and families? And are we using the information in an ethical manner? but also outcomes. Are we identifying more infants? Are the rates of infants that have been removed from their homes decreasing? Are parents completing drug treatment? Are we seeing those families again? And are there more reports of child maltreatment? And finally, impact. Are children better off in our communities? Can we see that throughout the data? And are we helping families keep their children at home and live, more productive lives in recovery? So thank you very much, and I look forward to hearing all of our discussion throughout the 2 days.
Thank you.
Good morning. Thank you very much for having me here. I apologize for not being here last year, but Paul is absolutely correct. I did go back and watch the video, and he said if Chris were here, he would say probably about 10 or 12 times. So today, just to make sure I know you're not picking on me, I hope to hear, if Jess were here, she'd say, once or twice. But thank you for having me. I am relatively new to ACF. My name is Chris Traver. I am a senior advisor for information sharing. Until about 2 weeks ago, or maybe 3 weeks, I worked for the Office of the Assistant Secretary. I was brought in by Maria Cancian, who was the immediate past Deputy Assistant Secretary for Policy. And Maria had a very strong and clear vision for what interoperability meant to her. And I know she was here last year, for those of you that were here, so you already got that perspective. But when she was asking me if I wanted to come on board at ACF, we started talking, and I asked her, well, what does interoperability mean to you? And one of the first things she started talking about was not technology and wires and connecting systems, but the ability of our offices, our human services agencies within ACF to communicate with each other. And that means a lot of different things, but it's fundamentally about how we do coordination and collaboration with each other that really underlies the importance of interoperability. I'm always thrilled to be in a group that speaks the language of interoperability. That's not always the case, as you can imagine. Interoperability, I think, is like even a half step beyond that. I'm going to have to train myself for that to roll off the tongue just as easily, but just as important. So when I go through the offices within ACF and talk with the leadership there about what are your pain points, what are the challenges that you're having with respect to interoperability, I get a lot of different answers. Some of them, I would say most of them probably deal with data in some way, shape, or form. We need to share data. We need to analyze data. We need to understand our data. But a lot of it comes down to organizational issues, to policy harmonization issues, to privacy and security issues that are preventing sharing, IT investment issues, procurement issues. I mean, it really does run the gamut. So somebody in my position that's responsible for interoperability writ large across ACF, I have to figure out how to deal with all of these things. I would say that our role there is really twofold. One is internally focused, where we know we need to do a lot of work collaborating between our program divisions and our human services programs. But also externally, which is really where my heart is, which is supporting our local and state partners in implementing their systems more effectively, and from the standpoint where their systems interact with our federal systems, that's important as well. But when you're talking about those two different sides, I think it's really important to realize that we're all dealing with the same fundamental kinds of issues. Just because we have a federal implementation problem doesn't mean that the technology that supports the solving of that problem is fundamentally different from what's being implemented at a state level. And similarly, across disciplines and across different agencies with totally different missions, the answer is largely the same, where we're all using the same technologies. We're implementing different business rules. We're designing the interfaces differently. We're collecting different sets of data, but the technology itself is largely identical. So we really need to get smarter with how we're procuring, developing, and customizing these systems, and it is possible to do. It just takes planning and foresight, and so that's really kind of the the mindset that we want to help encourage. So coordination is key. And I'm sure this is a theme that we'll talk about quite a bit on this panel, and you'll hear all day long, so I won't harp on it. But if Jess were here, I'd probably say that one of the first examples of great coordination is with her office, CMS, on the Zone Collaboration Portal, which is really designed to support state efforts to build integrated eligibility and enrollment systems. And E&E, as we call it, applies to a lot of different programs, and a lot of them use the same exact set of information on which to base those eligibility determinations. So that's a very simple example, but it's an example where we're not really doing that today. It's obvious, we're getting better at it, but we need to do even better. So in terms of just speaking briefly about some of the things that are happening within our office, so I'm involved in the Interoperability Initiative. There are several other folks in the audience. I won't pick on you because I'm feeling generous today. But there is an interoperability team within ACF that is slowly growing. We're bringing folks together from a variety of different places within the organization. We're also hiring several new positions. In the next few weeks, I believe we'll be hiring a privacy expert position. We're bringing in folks from all different sectors of human services and beyond to help us with this challenge. I come from the Office of the Assistant Secretary, but we're in the process of moving to the Office of Planning, Research, and Evaluation, which I think will be a great move because that's really the data-driven center of ACF. And they really understand the importance of data and how it's shared and how it's used across all the different ACF offices. But this integrated team will really work together to help us think through these challenges and then solve these problems. And so I am very new to ACF, as I mentioned, but the work goes back several years. So I know this group has been active for quite some time. We have interoperability products that are available on our website that go back several years, including the National Human Services Implementation Architecture, or NISIA. There are products related to privacy considerations in terms of overcoming the barriers when you're talking about data exchange. So my point in mentioning these is to say that we're not starting from zero. There's a fantastic foundation we're building on. But I will say for the last several years, this is not an area that ACF has really invested a lot of resources into. So those products came out a few years back. They were well received. I've heard lots of great examples of how they were implemented and adopted at the state level. But we haven't really had the resources to keep that momentum going. We haven't had grant programs in place for several years. We don't have technical assistance. We have some training, but not a huge amount. So there's really an organizational investment right now happening in the area of interoperability, and it's something that I think we really want to capitalize on. In that vein, we did submit a budget proposal that made it into the President's FY17 budget for a human services statewide longitudinal data system grant program, which also includes a technical assistance component as well as a software development component. I don't want to spend too much time on the details of that unless you're interested, but take a look at that. We're really hoping that that is something that you all can support and that will get enacted next year. That'll give us some great ability to actually execute and implement some of the concepts that we're talking about in the real world, so that will be fantastic. But I want to kind of bring it back and sort of end my opening remarks with some discussion around cross-boundary data exchange, because I really think that's where the current focus is. And within ACF and across our different program divisions, and I'm sure this is true in your organizations and across the states as well, you know, we're siloed. You know, we have our different areas where, you know, we receive funding to do a specific job, and we need to build a system to do that job, and that's our main focus, and anything else is frankly secondary. And that's kind of the expected response to the environment that we operate in. But you know, we're finding that with a minor investment in planning and architecture when you're initially building those systems, they can be built in such a way to enable information sharing with other entities, other disciplines, with minimal effort. I can't tell you how many times we see folks build these systems and then they just think, well, we'll just build a connection to the next system. And of course you can do that, but it's going to cost you a huge amount of money to do that. And the vendors will be happy to do it for you, but you're going to pay for it big time. So the key is to plan this up front and build systems in an interoperable way to make that more cost-effective and easier from a technical integration point of view. So this cross-boundary data exchange is really where we're lacking today, or where we're starting to make progress, but we need to accelerate a lot more. We all do great work within our own silos, but we need to connect the silos, essentially. So a lot of the work that we've been doing so far is trying to connect those silos within ACF. So just to list a few examples, I've been asked to consult on an initiative to improve background checks across ACF programs. A lot of our programs are getting new mandates to conduct background checks, in some cases including criminal background checks for staff that work, for example, in child care offices or that work with children on an ongoing basis. In some cases, this was already a requirement. In some cases, this is a new requirement. But we have at least a half dozen agencies that are currently looking to implement a background check system. So that's almost by definition a cross-boundary problem. They all need different sets of information to do their checks, but it's the same fundamental process. So we can implement the same solution that will work for everyone. If you've heard about the issue of unaccompanied children at the southern border, this is a huge challenge for us right now. And that's also a cross-boundary issue because the children come to us from the Department of Homeland Security. They're the ones that receive these kids at the border. They get handed off to ACF, our ORR office, and they're the ones that process and place these kids into more permanent homes. That's a non-traditional partnership, if I've ever heard of one, Homeland Security and Human Services. But that's something we do all day, every day. And so we don't really talk with Customs and Border Protection about how our systems connect very often. But this is a critical case where seconds and minutes matter to get these kids moving as quickly as possible. So we have to have those conversations. And I'll skip over some of these so I can wrap up. But the last one I want to talk about is the prescription drug opioid crisis, because I know that's one of our key focal points here today. And this is especially important to me. My previous job was at the Department of Justice, where I managed the Howard Rogers Prescription Drug Monitoring Program, which is the primary funding vehicle that funds state prescription drug monitoring programs that tracks the dispensing of these prescription opioid medications. So we were on the front lines of this issue day in and day out. And fundamentally, this is a data sharing challenge. The state systems, when I started working on this, were not connected. Somebody could literally walk across the state line and their prescription history was non-existent. And people were doctor shopping, and it was very easy to divert medications. All kinds of things were happening that really, until we figured out how to develop a method of sharing PDMP data nationwide, which does exist today, but it's not adopted by all 50 states yet, this was a big gaping hole in our protection measures to help guard against this kind of epidemic. So, and these issues are highly linked. People will tell you rightly that just because you take prescription opioid medications doesn't mean you're going to end up taking heroin. But a huge percentage of new heroin initiates started with prescription opioid medication. So there is clearly a link, and there's a very important role that these prescription monitoring programs play in combating this issue. And this was fundamentally a data sharing interoperability issue. And I've spent years and years trying to solve this problem, and it wasn't about the technology's not available, it doesn't exist to do this kind of thing. Of course it exists, of course it's there. It's a matter of figuring out how to implement it to this specific use case, which, by the way, the idea of an interstate data sharing hub has existed for decades. We didn't invent this concept. We just figured out how to apply it and adopt it in this new environment. So fundamentally, as I mentioned, this is all about coordination. It's about figuring out where our gaps are, where our systems are not communicating, and providing the tools and resources to help us build more connected and more interoperable systems. I think Melinda said that, the key is really that it's not about outputs, it's about outcomes. So what are the questions that we need to answer about what programs are effective, how could they be more effective, what combination of programs would be most effective? It's not just about collecting purely administrative data and counting the numbers and saying how many people did we serve and this and that. It's about what were the outcomes that were provided there, and we need to build our systems to be able to answer those questions. And for them to be able to answer those questions, that requires interoperability, because these stovepipes aren't going away. So I think that's it for now, and thank you very much.
Thank you all. This is very, very helpful. I have a few questions of my own, but I'd rather open it up to the floor for you to ask questions of these people. And I see Richard has his hand up.
Kshemendra, could you talk a little bit more about the intelligence activity in New Jersey and how it relates to the opiate crisis?
Sure. It's called the Drug Monitoring Initiative, and what they do in New Jersey is anytime there's an encounter with law enforcement that involves heroin, they collect certain information and get that to their statewide fusion center. So that's branding information on the glassine envelopes, that's lab results where they look at the material, and they turn that around in 24 hours as a standard report that goes out. One of the things they've discovered as a kind of an analytic pathway is that while there might be an overdose or an encounter in an inner city area, for example, the people that are encountered come from a different part of the state, right? So by going upstream, they can target public health interventions. So that's been a successful activity. It's also useful from a resource allocation perspective. They've been able to bridge between the public safety and the public health. Their Secretary of Health and Human Services works with the Attorney General, the Superintendent of the State Police, so they're able to share that information and have worked out the processes to make it so that on the Health and Human Services sides, they can actually use that kind of real-time intelligence. You could imagine how that could be useful in the law enforcement or counterterrorism space, but in the human services space, they're not always organized for that sort of actioning that sort of real-time intelligence. So they've been able to do that. The New Jersey is a unique structure in terms of the labs and how they're organized, the strong state government there. So that model doesn't replicate everywhere, but they are looking at it in other places and the like. Yeah.
Any discussion? New Jersey's located close to several other states where it's easy for people just to, let's say, cross the Delaware River from Philadelphia and you're in New Jersey, or cross the bridge and you're in New York. Where's the interstate cooperation?
It's actually pretty big, and it's something you can imagine, whether it's terrorism or organized crime or just violent crime. There's a sharing of information that's pretty robust. There's privacy policies in place. There's infrastructure for sharing from the federal government to the state and locals and the other way around. So that kind of thing is pretty robust and is going on. The bridging between the law enforcement community and the public health community, it happens everywhere. Law enforcement's on the front line for a lot of activity and does referrals all the time, but making that more systematic is a current topic of conversation across the country.
And they also share strategy development across public health and public safety, so they work together to figure out how to deal with prevention problems.
I'd highlight last year, the Department of Justice's Global Justice Information Sharing Initiative did a detailed study with the ISES Institute about what I call boundary use cases between public health and human services. That was submitted as part of the National Interoperability Roadmap out of the Office of the National Coordinator for Health IT. Chris was a key part of that, and not only did the HHS like the report, they hired Chris. So there's some progress on that, but yeah.
Other questions? Yes. Do we have a mic?
No,
Right up here in front. Hold your hand up, she'll find you.
Not under pressure, great question.
Okay.
Good morning, and thank you, everyone, for being here. I would like to hear a little bit about the two-generation approach that's been emphasized by ACF. We're talking a lot about the point of intervention with the user themselves, but I think for the human services and prevention, we need to talk and widen that aperture, and I think from what I understand, that two-generation approach may begin to tackle some of that.
Sure. We've been talking a lot about the two-generation approach, not only in our Office of Head Start, Office of Child Care, but really looking at providing interventions for children and also for their parents. And so that's where that initiative is really taking shape. I think in child welfare, we've done that a lot, recognizing that children are impacted by what's going on, in their parents' behavior and whatnot, and so those are often two-generation interventions. But I think under Assistant Secretary Mark Greenberg, it's really taken on a lot bigger initiative, and we're starting to evaluate it through OPRE and different programs.
All right, thank you.
There's another question right behind there.
Hi, Dave Walsh representing the Might Attack Kshemendra. I've had the chance to work with you over the last couple of years in the ISSC and so forth, and one of the things that I noted was that your team is very, very competent. They know what they're doing, but it's a complex subject. It really is. Have you all given much thought to how you can make that available at a higher level, dumb it down, if you will, so that others can really utilize all the good work you've done?
Yeah, thanks, Dave. Thanks for that question. It's a great question. It is a hugely complex topic when you look at the different layers of interoperability, from at the lower level, technical, data, business, policy, looking at the legislation, looking at policy frameworks in different communities and all that. The answer is absolutely yes. We are looking and we are making investments to what I call productize in a mission agnostic way the frameworks and all that. So I went through it kind of quickly, but there's a lot of really good work that's going on under the Standards Coordinating Council, and your group participated in a few sessions with the Standards Coordinating Council, and I know Jess was announced something recently about an industry outreach, and so I'll follow in the theme. If Jess was here, I was going to highlight maybe there's an opportunity to model on or leverage or borrow from or somehow reuse some of the work we've done, some of the structures we have in place as a way to drive a consistent approach to information interoperability. Some examples of where we're making these investments, I talked about the playbook earlier, right? So that playbook, the genesis of that was a captain with the New Jersey State Police that called me up one day and said, we're ready to go, we're midstream with doing this New Jersey information sharing environment, what do I do next? And he was at a procurement place, and I'm a Fed, and he's state and local, and I'm arm's length from his procurements. But I gave him a little advice, but then I thought about it and said, we could do better than me giving kind of one-off consulting. And the answer is, okay, here's a playbook that gives you, a play that you can run at different stages of the system development life cycle. We think that is a key entry point to on-ramp into this interoperability goodness for most folks, not all folks, but for most folks. And then we're looking at some other things like beefing up the maturity of some of the working groups that do the governance work, so on and so forth.
And by the way, with Kshemendra's staff and Kshemendra are very interested in your feedback on that playbook. All you have to do is go to standardscoordination.org, and you'll find it on the home page of the ISE playbook. It's in really a draft form. We're working on release 2. And your input to the utility of those plays and how they do exactly what you're talking about, Dave, is making it clearer what the on-ramp is. Kshemendra would welcome your feedback. Okay.
Good morning. I really enjoyed your conversation, and one question I had is, at the local level, we're doing a lot of the integration interoperability work across health and human services, because that's our world, right? Public safety and HHS, criminal justice, reentry populations, all of those things. The question I have for you is, how best do you think you can support at the local level the work we're doing? So we start doing integration, we start doing interoperability, then we hear about HIPAA audits coming down to local government. It's frightening, right? So on one level, as public agency, federal folks, you're pushing us to integrate, to interoperate, to have these conversations. And then on the flip side, either the Office of Civil Rights or somewhere else, there's a conversation about audits. So how do you reconcile the two, and how do we reconcile the two? And what should be our response when these kinds of indicators, if you will, from the federal government? They're very confusing, I think, for us at the local level.
That's a really good question, and I can answer it many different ways, but so rather than try to project the way that we've done it or not done it in the past, I would say that our office today would love to hear about the challenges you're having, and hopefully we can get better coordinated from a federal perspective. I have heard over the years many complaints from our state partners that the requirements that they get handed down to them from the various federal departments and agencies are completely incompatible with each other, do not reference each other, are sometimes in direct opposition to each other. And in my experience, that's primarily about funding issues, but it's also about policy and audit issues as well. And from a technology point of view, I think we're trying to do a much better job of aligning the standards frameworks that cross those different communities. So for example, we've been working a lot to try to bridge the gap between the standards that are used in the justice community called global standards or the National Information Exchange Model with some of the standards in the health space like HL7, which is a critical pain point that our folks tell us about. So trying to do a better job of aligning those frameworks we feel like is the key step from a technology point of view. And from those other perspectives, I think I'd love to hear more about how you think we can help you.
Ivan, like to use the mic.
Thank you. A little follow-up on that question, which I don't mean to be a downer, but one of the things I haven't heard a lot yet is this issue of privacy and consent. And let me just explain a little bit more. I was the CIO of our Illinois State Health Information Exchange. I'm out of that now. But one of the problems we had, and I think exists probably a lot of places, is that federal law like HIPAA, the state of Illinois came up with a lot of laws around data privacy and sharing before HIPAA even existed. A lot of them revolve around mental health. Right now in the state of Illinois, there's really a complete contradiction around data sharing because what you even mean by mental health data is very complicated. And then we have this federal level. I mean, it's nice to be able to technically share data, but one of the problems, and I think the feds are the only ones that can help us, is to start uniformizing the laws around privacy and security in a way that makes it easy to share data. Because right now, a lot of the data sharing, at least in Illinois, and I'm sure a lot of other states, is opening a path to, like, attorneys to come in and sue like crazy for, no really good reasons, but the legal framework that we need to share all this data, I think doesn't really exist. There's all these different ways of sharing data, privacy. Everyone who's got a credit card or a bank has no idea what's going on, and then we just add more and more onto this. So I think it's a really critical thing, and I haven't heard enough. I mean, I've got my own ideas, of course, but I haven't heard enough about what needs to be done, because I think at a very practical level, if we don't solve the problem of privacy and consent in a way that's consistent and basically lowers the viscosity of the transformation of data rather than increases it, I think these enterprises, at least in terms of serving people through the states, I don't see how it's going to work.
Well, that's a very good point, Ivan. I think one of the things that Kshemendra's office is working on is this whole notion of federated identity and privilege management, that it really is a showstopper, not only across states but within states, that ability to know who is accessing the data and for what purpose, and to authorize that purpose. And that's fundamental to that whole issue of delivering it. It's also true, and we all know this, that the privacy regulations are based on the 1950 Accord for International Privacy Agreements, that have never been fully rewritten to take into account the technology revolutions. I would love to continue this, and I want to thank our panelists for doing this, but I'd like to get us back on schedule, so we're going to take a break now, and I'd like you to shorten it so that you're back here in place at 10:45 for the next panel, and thank our panelists for their help.